Ray Fitch from Vet Triage here. Good morning. This will be published on January 31st, 2025. We are starting off with the very first article in a brand new journal. This is Veterinary Surgery, and it's from April of 2022. And we are going to be talking about a fairly comprehensive, fairly long review on ground reaction forces, best practices for measuring and reporting ground reaction forces in dogs. And this comes out of the University of Minnesota, University of Missouri, University of Wisconsin-Madison, the Orthopedic Surgery Department from University of Missouri, Cornell University, and University of Georgia. So for those who don't know, ground reaction forces are a way to measure a dog's feet as it impacts the ground. We use ground reaction forces and similar techniques to figure out where the dog is limping, what leg or legs, and then be able to not only help us figure out anatomic localization, so which leg is affected, but also figure out response to treatment. If you take a dog and you discover on ground reaction forces they have a lameness in whatever limb or limbs, and then you treat them with something, medications, acupuncture, physical therapy, surgery, whatever, you can then also compare that to those values to future values. So you can see what the response has been, if any, to that treatment modality. So it's a very powerful technology. Not all places have it because it is expensive. And of course, as we're going to find out from this paper, there's a lot of nuance to measuring ground reaction forces, and even more nuance if you're going to publish data on it. So that's the whole point of this paper. So introduction. A ground reaction force is defined by Newton's third law for canine kinetic gait analysis. Ground reaction forces are the forces between the dog's feet and the ground. Measuring and reporting these forces as a component of gait analysis in the dog has been pivotal to our understanding of normal and abnormal limb function, severity of disease burden, and impact of both pharmaceutical and surgical interventions. So, second part, clinical tools to measure a ground reaction force. Ground reaction forces, specifically vertical, known as FZ, craniocaudal, known as FX, and mediolateral, FY, forces can be measured by specialized equipment, including force platforms, pressure mats, instrumented treadmills, and static platforms. Force platforms, or plates, use load cells to measure forces exerted on the ground during the stance phase of the gait cycle. The load cells may contain piezoelectric elements, strain gauges, or beam load cells. Other information that can be obtained includes the center of pressure, the center of force, and the moment around each axis. Software then calculates the raw newtons generated, which in turn can be converted into several output forms, including percentage of body weight. Then the other technology called pressure mats. These pressure mat systems measure pressure placed on the ground. Spatial mapping of foot contact allows other spatial measurements to be calculated, such as stride length. And then alternative measuring tools include instrumented treadmills that make use of force or pressure sensors, and also static ground reaction force and collection systems. So the consensus statement with regard to this section is, regardless of the system that is used, only one method of collection should be used in any single study. Number 3, quality assurance. There are several standard operating procedures that should be implemented for gait analysis. Number 1, equipment validation and calibration records are needed. Number 2, dog training. The dog and variance between trial repetitions contribute the greatest amount to variation of ground reaction force results. The dog should be weighed accurately on a calibrated scale and trained to walk on a leash over the testing walkway at the expected testing velocity by the personnel who will perform the test. Trial variation has been shown to be the greatest with the first 3 valid trials, so we recommend that dogs complete a minimum of 3 acceptable training trials prior to data collection. Training of personnel that handle the dogs can be minimal, as handlers contribute only 0 to 7% of variance in ground reaction forces, suggesting that multiple handlers may be involved in experiments without appreciable influence on the results. The third is define an acceptable trial. The definition of an acceptable trial should include how the experiment will monitor velocity, acceleration, foot strike pattern, and a minimum number of acceptable trials that will be collected, and the maximum number of trials completed when attempting to collect acceptable trials. Use of video to document valid trials is ideal. And then lastly, data processing. All acceptable and unacceptable trials should be kept and stored. Consensus. A quality assurance program for gait analysis should be a part of every laboratory, and the details should be reported in scientific manuscripts. Section 4, subjects. The majority of ground reaction force variation between breeds of dogs attributable to conformational differences in trunk and limb size and shape. Dogs with shorter limbs require more rapid limb velocity to reach a specific trunk velocity compared with the limb velocity needed for a subject with longer limbs. Radiographic disease is a poor indicator of clinical symptoms. In general, when multifocal joint pain is present, dogs have complex gait abnormalities and it's more challenging to interpret ground reaction force data. It is also possible that when multifocal joint pain is present in both front and both rear limbs, front to rear limb asymmetry can be used as an outcome measure. Front to rear limb asymmetry would benefit from additional research. A mild degree of asymmetry, about 2 to 3%, is normally found in healthy dogs. Increasing the symmetry index cutoff, meaning using 6% instead of 3% asymmetry, increases the chance that only abnormal dogs will be included. It also increases the chance that a measurable change, improvement after an intervention, can be documented in that study. Consensus statement. Studies with subject heterogeneity should report how the influence of heterogeneity in ground reaction forces were controlled. Complex gait abnormalities are common and can be studied, but reports should include how change in ground reaction forces with an intervention might be influenced by gait complexity. Limb asymmetry is a common outcome measure, but it should be reported with other ground reaction forces such as peak vertical force and vertical impulse in both the unaffected and affected limbs. Section 5, velocity. Torso velocity, limb velocity, or stance/contact time. Let's go into that one. When using a force or pressure platform, subject torso velocity is typically measured using a series of retroflective targets matched with lasers that are set to the height of the subject's torso and that begin before and extend beyond the platform. When the subject breaks the laser connection with the reflective target, a digital signal is created and immediately reported via the program software. When this occurs with 2 consecutive targets, velocity can then be measured. When this occurs over 3 consecutive targets, acceleration can be measured. Pressure platform walkways can measure limb velocity if the subject takes at least 2 steps on the walkway and the software measures both distance and time. Stance or contact time has been used as surrogate for limb velocity because it reflects changes in velocity, peak vertical force, and vertical impulse. There is a strong negative correlation between trunk velocity and stance time because the faster a dog moves, that is increased velocity, the less time its paws spend on the ground. As dogs with different limb lengths have different limb velocity, even though they have the same torso velocity, additional normalization of the velocity data is the best practice when investigating a heterogeneous population. And I forgot to mention, there's a picture there of an example of a beagle with force plate analysis. So you can see there at the ground reaction forces how they're measured. They have their 2 force plates are placed next to each other. There's a walking path. There's a frame with through beam photoelectric sensors, and then there's the beam of photoelectric sensors there, and then it shows the handler and the dog, and then 2 force plates placed next to each other. So just an example of one type of machine. Okay, walking or trotting velocity. Studies of dogs with severe lameness are best undertaken at the walk to avoid too many invalid trials and to decrease the coefficient of variation. Measurement of static weight bearing can be considered in dogs with severe lameness. Studies of dogs, and the reason why they say that is because imagine you have a dog with severe lameness, meaning they're holding the leg up. How can you measure that leg if they're holding it up if it's not going to touch the ground? And so if you walk them slower, usually dogs are more likely to put their foot down at least briefly. Studies of dogs with mild lameness are best undertaken at a trot where the power to detect subtle changes in lameness is improved. Okay, next section. Fixed or preferred velocity range. A fixed velocity range for walking, meaning 1 to 1.3 meters per second, and trotting, which is 1.7 to 2 meters per second, has been used for dogs. The use of narrow velocity ranges, meaning plus or minus 0.3 meters per second, with controlled acceleration, meaning plus or minus 0.5 meters per second squared, has often been recommended to minimize data variance. However, when using a fixed velocity in a heterogeneous group of dogs, some dogs may be required to walk or trot outside of their preferred velocity. Therefore, it may be the result of subject fatigue and worsening of lameness during trial collection, which is pretty cool. I never thought about that the dog actually can get tired with repeated trials. Consensus statement: torso velocity should be measured and controlled. Investigators should consider normalizing velocity to subject size if a heterogeneous population is studied. If limb velocity is measured directly using a narrow velocity range, no additional normalization procedures are needed. Subject velocity, meaning walk or trot, fixed or preferred, should be determined based or before the onset of the study and should remain consistent throughout the study. A narrow velocity range of 0.3 meters per second or less is recommended to minimize data variance. Velocity impacts ground reaction forces, and a 0.3 meter per second velocity range represents 15% to 30% potential difference in subject velocity, so it is essential to evaluate the influence of velocity differences between groups and over time on ground reaction forces. Section 6. Normalizing data to reduce variability. Factors that influence ground reaction forces include subject size, conformation, velocity, acceleration, symmetry between limb pairs, trial repetition, and day-to-day variation. Most studies use a fixed subject velocity with a narrow velocity range and normalize data in dogs to body weight by reporting data as a percentage of body weight. The use of body weight normalization normalizes ground reaction forces, allowing clinicians to account for fluctuations in body weight for individual patients at different time points, and it aids in the comparison between animals of differing weights. The peak vertical force. Previous research has shown that the normalization of peak vertical force and vertical impulse to body weight results in data with low variability, meaning 8.5% or less coefficient of variation. When peak vertical force was normalized to body weight, there was a 73% and 71% in the reduction of the coefficient of variance for thoracic and pelvic limbs, respectively. Similar findings are seen for vertical impulse when normalized to body weight, with a 78% and 71% reduction in the coefficient of variance for the thoracic and pelvic limbs, respectively. They prefer to use wither height. The use of shoulder height instead of wither height has been evaluated, but wither height is easier to measure and not subject to left-right variation. When ground reaction forces are normalized to wither height, there is an additional reduction in the coefficient of variance, so a 6% and 11% reduction for the thoracic and pelvic limbs, respectively, over that achieved with body weight normalization alone. The use of wither height for the normalization of a pure time-related variable, stance time, resulted in a 43% and 47% reduction in the coefficient of variance for thoracic and pelvic limbs, respectively. The normalization of velocity using withered height to address animal size disparity can be referred to as the Froude number. That's F-R-O-U-D-E. Or known as dynamic similarity or relative velocity or torso velocity normalized to body size. Alternatives to normalizing to wither height include studying a homogeneous population, a breed matched case and control groups, or a block randomization based on subject body size. Consensus statement is: normalization of ground reaction forces to body weight is essential. During investigation of heterogeneous populations, one should consider using one of the additional methodologies, either normalization of subject ground reaction forces to wither height, block randomization of dog size, meaning wither height to ensure equal distribution across groups, normalization of subject ground reaction forces to contact or stance time, and then statistical evaluation of the groups to ensure that dog size did not influence results. Section 7, trial acceleration. Electronic documentation of acceleration may be preferred to control variance in the data and provide quality assurance to the data, as it does not rely on the experience of the individual assessing subject gait variations. Consensus statement regarding that: to minimize effects on vertical forces and provide the opportunity to utilize other ground reaction forces, the best practice is to include acceleration as a variable to determine if a trial is acceptable. An acceleration range of plus or minus 0.5 meters per second squared is recommended. Number 8, acceptable trials. The collection of gait analysis data can be performed in 2 ways. Each trial should be collected, immediately reviewed for appropriateness, and then either digitally indicated using the software as an acceptable or unacceptable trial based on a priori inclusion criteria. The second method is by recording a large number of trials consecutively and then reviewing them as a group before ending the testing section. And that first part is what's ideal, is to review them all in real time. Consensus statement: when possible, trial data should be reviewed immediately to identify valid trials. To avoid selection bias, the number of valid trials to be studied should be determined at the outset of the study, and only the first set of valid trials that meet the established collection number should be analyzed. Section 9, number of valid trials. And just so folks know, there is 13 sections here. We're on section 9. Number of valid trials. In veterinary medicine, 5 valid trials are used for analysis in most studies. This number of trials is associated with a low degree of variability in vertical force data, so both peak vertical force and vertical impulse in both a homogeneous and heterogeneous population of normal dogs. When collecting 5 valid trials, less than 5% variance in vertical force data, meaning peak vertical forces and vertical impulse, are attributable to trial repetition. The use of multiple inline force plates may reduce trial collection time and repetition. Consensus statement: 5 valid trials are the current gold standard for homogeneous and heterogeneous populations. Number 10, non-weight bearing lameness. In these situations, data collection with force plates is challenging, often not possible due to gait changes secondary to non-weight bearing lameness. The use of a pressure walkway system may prove valuable and will allow the collection gait data from the weight-bearing limbs. Section 11, optimizing gait data collection. And by the way, if the dog is non-weight-bearing lame, obviously what leg is the problem, so it's kind of a nicety to have that, but I'm not sure that's really that important. Section 11, optimizing gait data collection. Kinetic gait collection in dogs is performed by walking or trotting subject across a platform or platforms by a single handler at a predefined velocity and acceleration. During gait collection, there should be no contact between handler and dog, no pulling on the leash. Any trial where a dog is visibly changing velocity, changes head position, it turns its head, raises, lowers its head, it breaks stride, or makes any aberrant motion should be considered invalid. A valid force plate trial generally consists of a distinct front and hind foot strike on the platform. Those trials where more than one foot or simultaneous contact with force plate results in an ability to accurately distinguish between some kinetic variables. These trials are invalid. It is important to habituate animals to the testing location and procedure. In most cases, several minutes or more are recommended. A high degree of variability was noted in the first 2 to 3 trials. Valid trials suggesting additional acclimation is necessary. In general, as animals' velocity increases, their limbs exert more force on the ground, thereby increasing peak force. But for a shorter period of time, meaning reducing the stance time, there is a positive correlation between velocity and peak forces and a negative correlation between velocity and impulse values. The impact of using different dog handlers for gait collection was shown to account for up to 7% of variance in kinetic data when using a force plate system and 8% with a pressure-sensitive walkway. It's ideal if studies could use a single dog handler for the study. Leash side, left or right side, did not affect pelvic limb, but did affect thoracic limb kinetic measurements by up to 12%. It is optimal for the handler to walk the dog on the preferred side and consistently use the same side for all trial and gait sessions. And finally, number 12, study design and stats. The National Institute of Health advises against using pilot data for sample size collections. A simple and ethical approach is to use sample sizes from similar successful gait studies if possible. Note that sample sizes should always be determined from clinically meaningful effect sizes rather than data-based effect sizes, which may be clinically meaningless. Group balance means that the treatment groups are nearly identical on baseline variables, so only the group treatment differences may affect outcomes. Groups should have similar distributions of variables that might affect outcomes like body condition scores, sex, body weight, age, and wither height. There's 13 sections, so we're almost done. There are many other biases that confound studies: confirmation bias, sponsor bias, and so on. Solutions to these problems can be discussed with the biostatistician. Every stats test has underlying assumptions about the data that must be true to produce correct p-values. For example, a single independent group t-test has 6 assumptions, meaning independent observations within and between groups. The groups must have the same variation and the observed means must be normally distributed. For example, 30 p-values from independent group t-tests require 108 data assumptions to be checked. P-hacking is the post-data collection manipulation of the data or study design, usually done to produce statistically significant results. P-hacking is well described in literature and is a reason why in many fields the results, about 60% of peer-reviewed articles, cannot be reproduced. Wow. There are 3 kinds of gate studies: pilot, confirmatory, and exploratory. Pilot studies are meant to assess feasibility and do not report p-values. Exploratory have general hypotheses, meaning we hypothesize that treatment A will be superior to treatment B, and many outcome variables whose statistical tests are used to probe for significance and suggest directions for future studies. And then confirmatory studies have 1 or 2 predetermined primary outcome variables with focused hypotheses, meaning we hypothesize that mean measurements for treatment A will be superior to treatment B 6 months post-operatively. The results of confirmatory studies are used clinically. They have the lowest chance of having false positive results. Finally, section 13, clinical application of ground reaction force data. Address the probability of change in the treatment versus placebo groups. Ground reaction forces in a group of dogs with osteoarthritis change minimally. It has been shown that ground reaction forces change as the disease burden changes after spontaneous and induced cranial cruciate ligament rupture in dogs. In a canine osteoarthritis caregiver placebo treatment study, it was found that 12.1% of dogs had a 5 to 10% increase in ground reaction forces. 8.6% of dogs had a 5 to 10% decrease in ground reaction forces, and 1.7% of dogs had a ground reaction force of over 10% change. Thus, ground reaction forces in individual dogs with arthritis can wax and wane over a short period, but a change greater than 5% is unusual, and a change greater than 10% is rare. If an intervention provided a greater than 5% increase in both peak vertical force and vertical impulse over a 2-month period in 75% of dogs, the reader then knows that there is roughly 65% chance that the dog they're about to treat with an intervention will benefit more than if the treatment was not used, and a 5 to 10% chance that a dog will change spontaneously. For non-surgical management of dogs with arthritis, interventions can be compared to those reporting the effects of non-steroidal anti-inflammatory drugs and omega-3 fatty acid diets. The change in ground reaction forces over time for these interventions range from 3.5% to 5.6%. Consensus statement: in dogs with arthritis, a change in both peak vertical force and vertical impulse over a short period of time, less than 6 months, of 3.5% is the minimum value that should be considered clinically important. The number of dogs in each group that have a change in ground reaction forces greater than 5% is a good outcome measure. Studies investigating the chance of dogs return to normal function should include investigation of similarly sized normal control dogs or use historical controls. The cost to purchase and install a force platform and software is up to $35,000 US. Pressure-sensitive walkways that report ground reaction forces in a similar way to force platforms can cost up to $40,000 US depending on the design, and they are mobile. Consensus statement: finally, ground reaction forces are an essential part of the process of estimating chronic joint pain because there are objective measurements generally directed by the patient. It's a great summary study. I love this kind of stuff, and it does show a lot of it shows the importance of these studies and how we can use them clinically in the field. Thanks, everybody. We'll see you again tomorrow. Bye-bye.